Here's my ID, Chelsea Harrell. Here's my audience, 5 adults. Okay, I'm going to do my speech on the prevention of disease. My first source is the CDC. In order to prevent diseases, the CDC monitors chronic diseases and risk factors. They conduct research, implement policies, and communicate health concerns and public preventative measures. In the CDC's chronic disease prevention program, there are 4 main domains. These include epidemiology and surveillance, environmental approaches, healthcare system interventions, and community clinical links. The CDC states that 70% of deaths are from preventative diseases, and disease is the leading cause of death in the United States. The Harvard Health School of Public Health states that the best ways to prevent disease are eating healthy, exercise, and limiting the use of tobacco and alcohol. The National Institute of Health and Disease Prevention discusses the importance of vaccinations. Vaccines increase life expectancy and reduces the contraction of infectious diseases. They prevent against diseases such as shingles, hepatitis A, hepatitis B, whooping cough, mumps, tetanus, flu, measles, meningitis, chickenpox, rubella, and HPV. There are tips for staying healthy against diseases. These include staying active for at least 30 minutes a day, at least 5 days a week, eating low fat, and eating lots of fruits and vegetables. Drink alcohol in moderation, if at all. Limit and eliminate tobacco use, and don't use drugs recreationally, and don't use drugs in a way other than recommended by your doctor and pharmacist. Practice safe sex, use protection always. Brush your teeth to prevent against diseases such as gum disease that leads to even worse diseases. And avoid exposure to UV sunlight. Use sunscreen, and don't go tanning. You should wash your hands a lot. You should get vaccinated. Don't overuse antibiotics, because if you overuse them, you'll build up a resistance, and then when you actually need them, they won't work. You should stay home if you're sick, so you don't get other people sick or make yourself sick from other illnesses because your immune system is weak. You should prepare food correctly, watch temperatures in meats. You should disinfect surfaces in your home, especially when you're sick, and disinfect surfaces in public when possible, such as shopping carts. Don't share things such as toothbrush, utensils. Don't eat or drink after people. The Cleveland Clinic states that it's important to use preventative care. Get your yearly checkups, get blood work when your doctor recommends it, get your well woman at least every year. You should watch your cholesterol and your blood pressure. You should sleep well, at least 8 hours a night, and more for children, and maintain a low body mass index. The Mayo Clinic gives tips to keep clean. You should wash your hands before and after doing things such as cooking, eating, sneezing, using the toilet, changing diapers, or shaking hands. You should use running water, lather well for at least 20 seconds, rinse them well, and dry with a disposable towel. And if you follow all of these steps, you can keep yourself safe from diseases and live a longer life. Here's my audience again.